Immunity. Number 5, we have acquired immunodeficiency syndrome, which is HIV/AIDS. This one is caused by a virus, which is HIV, human immune deficiency virus. Effects and areas affected. So we are saying the virus belongs to a group of viruses called retroviruses. So the virus that causes HIV/AIDS belongs to a group of viruses known as retroviruses. So it affects and destroys certain white blood cells. So this one affects the blood circulatory system. In particular, affects the T helper lymphocytes, which are involved in defense of the body against disease and infections. So this virus attacks the immune system, as I have said, so that the body is defenseless against infection from the diseases. So there is no cure for AIDS. No matter you can fly to UK, to South Africa, if you are affected, you are affected. There is no cure. Phases of AIDS. Phases of AIDS. In the first phase after infection, the HIV antibodies. So there is short flu-like illness, skin rash may develop, and swollen lymph. So generally those are in the first phase. Soon after infection, a person may produce antibodies. But at the same time, there could be some signs like skin rashes and swollen lymph nodes may be noticed. B, we have the second phase. In the second stage, there are no symptoms of infection. So generally, those symptoms in the first phase may disappear. So this stage can last for a few weeks to over 20 years. In the following progression, the person may contract or be vulnerable to opportunistic infection. Opportunistic infection, we mean infections that come in as a result of weakened immunity. When the CD4 count is below 200 per cubic meter of blood. So the person may show mild sign of these infections, but not yet life-threatening, such as oral and genital herpes. Loss of weight is common at this stage. So a person even loses weight. So in this next progressive stage, opportunistic infections occur. Some of the examples of these opportunistic diseases, we have cancer of lymphatic system, which is lymphoma cancer. We have pneumonia, severe diarrhea, tuberculosis. So body organs get diseased and secondary cancers can form. So there are those symptoms. Mode of transmission, HIV/AIDS transmitted in a number of ways. The first and common one is sexual intercourse, because the virus is very common in fluids. It's very common in fluid. Reproductive fluids, that is to say. So sharing of hypodermic needles with an infected person can also transmit AIDS. Blood transfusion, if the blood is infected or is contaminated with the virus. Infected mother to the newborn babies during birth in the birth canal. So when the mother is giving birth, during that time, the child can also contact the virus. Mother to child through breastfeeding, it is also possible. That's why at hospitals, they usually stop mothers who are affected with the virus to stop breastfeeding their babies. Mother to fetus through placenta. You know, placenta is a barrier that separates the blood of the mother and that of the fetus. So it performs a number of functions, but the virus can diffuse from the maternal blood to the fetal blood. Therefore, it can just pass through the placenta by means of diffusion. Now, symptoms of HIV/AIDS. 1. Multiple signs based on opportunistic infections. Now, because the immunity is weakened, every simple disease affects an individual. Chronic diarrhea for more than a month. The person is just passing out waterless stool. Persistent and severe coughs which last longer than a month. So generally a person coughs persistently, that is continuously. That can happen for a month. Sudden loss of weight. There is low CD4 count, which is when the CD4 count is less than 200 per cubic centimeter of blood, then a person is having the virus. There is low immunity because the virus attacks the T helper lymphocytes or the T helper cells, which actually direct the killer T cells to attack the pathogens. Control and prevention. How is it prevented? So how can we prevent HIV/AIDS? So HIV is highly mutative, which means it undergoes mutation, and this poses a challenge in developing an effective vaccine against it. Now, because it is changing over time, that's why the scientists are failing to find the vaccine against it. So abstinence is an effective method of avoiding sexually transmitted what? HIV. Female condoms may prevent the transmission of HIV and other sexually transmitted infections such as gonorrhea as well as what? Syphilis. Behavior change can reduce the risk of catching the infection. For example, abstinence, care and treatment of people with HIV infection. When you happen to have a relative who is suffering from HIV/AIDS, how best can you manage the disease to help the person stay longer? The person must be advised to be put on antiretroviral treatment. This treatment aims at preventing or delays the onset of AIDS and prolongs life in the process. So what the ARV do is simply to prevent attachment of the virus to the white blood cells. So therefore, that compromises the multiplication or stops multiplication of the what? Virus. So disadvantages, many cannot stand the side effects of the drug. Disadvantages of the antiretroviral treatment is that many cannot stand the side effects of the drug. At the same time, some of them may not observe the dosage, may not observe the prescription by the medical doctor. So the cost of the drug is also very what? Expensive. You need to cough a lot of money. So we are saying proper use of both male and female condoms may prevent the transmission of HIV and other sexually transmitted infections, gonorrhea or syphilis. Voluntary counseling and testing can also help. Make sure that if a person is diagnosed HIV positive, must seek medical counseling where the healthy personnel can talk to that particular person to say that his part of life can still survive. VCT centers provide very important information on cell status, that's HIV status, through testing. So people must be encouraged to go there to test so that they can know how to manage themselves. For those HIV negative, get counseling on how to stay safe and plan their future. So for those found with HIV AIDS, are able to access care and support services plus treatment of opportunistic what? Diseases. So these people, so for those found HIV positive, get counseling on living positively, so that you have to live positively with your friends or life as it is. Having proper food and nutrition must be given. Make sure that must be given nutritious food, especially eggs, meat, and what have you. Avoid stressful situations. Have a positive attitude that fosters living positive what? Styles. All right, we are going to continue with our topic. Now, let us start. Let us look at the signs and symptoms. Signs and symptoms. So generally, the signs that there are round gray patches on the head and the face, number 1. 2, itching on the gray patches, that's the ringworms. These are the signs of ringworms. Hair loss on the patches. So generally, a person who is having ringworm, you will see that there are patches in the head. There is a circle thing like a round patch. So around that one, there is loss of hair on that side of affection. So control and treatment. So how can we control the ringworm as the information that we have? So on the treatment of the ringworm, so I was saying treat using fungicide creams and tablets. So there are certain fungicide creams which they just put as an oil on that affected site. So generally, the fungicide creams are there in the shops. You can access them in those particular areas. Hygiene care of hair, most of the times, make sure that you clean your head with soap most of the time. So generally, ringworms are very common in children because those children, they like playing in sand, in whatever. So, and most of the times they don't clean their heads. So that's why they catch this particular disease. But most of the times, the hair must be combed. Must be well kept. The hair must be well kept. Avoid sharing combs, brushes, and hats. Most of the times, because we depend on each other, we tend to share combs when we are combing our hairs. So most of the times, the brushes are also shared. At the same time, the hats. We have seen people protecting their heads with the hat. Maybe you have shaved a very unique style, then you are hiding from that. Then you are using a hat of your friend. So this one must be avoided. Otherwise, ringworm will be a problem. So if these are avoided, then generally no spread of ringworms. Then another disease that is caused by another fungal disease is thrush. Thrush is another fungal disease that we have to look at. So this one we're saying is caused by fungus. So fungus is a microorganism that can be found in most of the areas. Effects and areas, which areas affects which areas are affected by the fungus, and what are its effects. So we are saying it can occur in the mouth. So this fungus can occur in the mouth, then it can also occur in the vagina, it can occur in intestine plus other places. So it can also affect other places apart from the intestines and what we have mentioned there. Mode of transmission, so this one is transmitted in different ways. So thrush is transmitted in different ways. Number one, through sexual intercourse. So most of the sexual intercourse exercises are there to spread the fungi. They are there to spread the fungus. So you must avoid doing such things. Occur due to changes in acidity of the vagina during pregnancy. So the changes in the acidity of the birth canal can also be one of the cause of the thrush in the pregnant women. So it occurs due to effects of diabetes problems. So most of the times this one takes place because one has got diabetes mellitus, which is a sugar disease. So those people who are associated with the disease are likely affected by the fungus. So symptoms and signs of thrush. So let us look at symptoms and signs. So on top of symptoms, these are the things that a patient feels, and then the signs, these are the things that you can see with your naked eyes. Now we have number one, fluffy white patches on the infected area with red inflamed skin under the patches. So generally there are fluffy white patches on the infected area with red inflamed skin under the patches. So they are like patches which are associated with the inflamed skin and the others. So severe irritation, there is severe irritation, there is a lot of pain and itching of the areas affected. So how can we treatment and control of the thrush? Number one, use of appropriate drugs that are prescribed by the doctor. Any medical personnel can prescribe the drugs for the thrush. We have another one, which is arthritis foot. So this one is also caused by fungus. So arthritis foot is one of the examples of the disease that are caused by fungus. So we have we have fungus. This one is caused by fungus. The arthritis foot is caused by fungus. So effects and areas that are affected. So we are saying commonly in warm, wet weather, the disease usually occurs due to what? So this disease occurs due to wearing closed shoes for a long time. So in terms of areas, we are saying it affects between the toes of the legs. So keeping the feet wet for a prolonged period of time, so can also cause the arthritis foot. Excessive sweating in the feet. So most of the time, arthritis affects the foot and especially between the toes. Mode of transmission, how is the fungus transmitted or spread from one person to another? So when we are looking at mode of transmission, we are looking at how does the disease spread from one person to another. Sharing shoes and socks. You know, some people have that behavior of sharing shoes at the same time they may share socks. So these ones can spread the fungus from one person to another. Signs and symptoms of arthritis foot. Number one, itching in the foot. So generally the foot itches too much. So you itch the area where it affects, especially between the toes. Pain in between the toes. So there are a lot of, a patient feels pain between the toes of his feet or her feet. Prevention and control. So how can we control this disease? We are saying proper drying of feet after bath. When you have taken the bath, make sure that you clean your foot, your feet now and again so that it's completely dry. That is to say, soon after taking a bath. Use of sandals in public showers, so you can use sandals to prevent entry of the microorganism, the fungus in particular. Change of socks frequently. Here you can change socks frequently. Don't just use one socks for a long period of time or number of days, day in, day out, you are using one socks. You can change and use a different one. Treatment with antifungal drugs such as powders and creams. So you can also seek powders and creams that can be used to control the disease.